Hi, Angel. Are you there?
Yes, I'm here. Hello, how are you?
Good. How are you? Just to make sure you're on, no problem. We'll get started in just a second, everyone. Good afternoon, everyone. We're going to go ahead and get started with our webinar today. If you are having any audio issues, if you can't hear me, please let me know, and we will see what we can do to address that. My name is Chip Lewis, and I'm Director of Communications here at NMAC. First of all, can everyone hear me? If you cannot, please let us know in the chat function. So I want to welcome you all to our final Community Spotlight webinar of the year, where we're looking at HIV in Puerto Rico after the devastation of Hurricane Maria over a year ago. First off, some housekeeping issues. All of your audio has been muted. However, if you do have questions, we ask that you ask them. We ask that you ask them in the chat feature here, located here. Just type in your answer and click send, and it will appear in the box here, and we will answer it at the end of the presentation. A little bit about NMAC for those of you who may not be familiar with us. We are now entering our 4th decade of service, and NMAC leads with race to urgently fight for health equity and racial justice to end the HIV epidemic in America. We do this through a variety of means, including national and regional training conferences, including the United States Conference on AIDS and the Biomedical HIV Prevention Summit, public policy education program, treatment and research program, and numerous publications, both hard copy and electronic. We also serve as an association of AIDS service organizations, providing valuable information to CBOs, hospitals, clinics, and other groups assisting individuals and families affected by the HIV epidemic. Today is the last in our Community Spotlight series. We did a series of webinars this year to celebrate and spotlight communities that bear greater burdens in the HIV epidemic, but are often invisible or overlooked due to issues of race, gender, or gender identity. You can find all of this year's Community Spotlight webinars on our website. They've all been recorded. They're all available in the webinar library on our website. They're also available on our YouTube channel. And today's webinar is also being recorded and will be included on the library and our YouTube channel probably tomorrow. So with that, I'll introduce today's presenter, Angel Luis Hernandez, who is a community advocate in Puerto Rico and a member of NMAC's constituent advisory panels. These panels provide NMAC with a lot of feedback from the different communities that we serve. They become a very valuable part of our organization. If you'd like more information on the panels, you can find that on our website. And with that, Angel, the floor is yours.
Okay, thank you very much. Good afternoon, good evening, and welcome everyone to the webinar. Can you move to the next slide, Chip? Well, we moved on to the next slide. As Chip mentioned, I'm a community advocate. I do a lot of work in rural areas in Puerto Rico, and part of what we'll be focusing today, although I was talking to other people and to other advocates who are HIV activists and who worked a lot in the aftermath of Hurricanes Irma and Maria, and the situation we'll be describing is pretty much similar across the island. You know that you've seen here on this slide that Hurricane Maria on September 20th, 2017 really affected the whole island. There was no place in the island that has not been affected. Well, they were a terrible 12 hours of waiting what was happening in the island. And we have a lot of difficulties. You see here that at one time after the hurricane, there was an official death toll of 64 people, but there are estimates that, well, at that moment we said that 4,600 of people were dead, but the estimates are probably double than that, although we recently knew an official report of the University of Washington that was, George Washington University, sorry, that was commissioned by the local government, set up the death toll around 3,000 people, but still unofficially, we're still seeing is around over 8,000 people that were directly that were dead because of the direct effect of the hurricanes Irma and Maria. So we don't really know what the estimated, what the actual amount is, but it was a lot. And part of the things that we were affected by the lack of electricity. Some areas got electric power more quickly than others, but for certain areas, especially rural areas in the island, most of them they got their electric power back almost a year after a hurricane. We're talking about around September of this year, and so, but still we have some areas that what the Electric Power Authority calls pockets that still have no power even 15 months after Maria, and that's really a terrible thing. Next slide. Some background information. It's not only around the hurricanes Irma and Maria, but also Puerto Rico is facing for a long time now, for more than 10 years, a very harsh economic situation. And the number of low-income people are getting higher, more than 50%, around 50 to 70% of the population is now under the poverty threshold, so that makes things a little bit more difficult for them and the recovery efforts. And specifically on the region that I live now is the Arecibo region, comprised of 13 towns. Our statistics are our incidence has been around 4,000 cases of HIV and AIDS. Although in general in Puerto Rico, the incidence since the cases of HIV and AIDS has been reported is around 40,000 people. But of that number, right at this moment, there are around 18,000 people living with HIV and AIDS. And in our region, we're estimating around 1,500 people, 1,500 people living with HIV in the Arecibo region, comprised of those 13 towns. And our HIV population has been affected because of the economical situation, but also that also affects the quality of life that we're facing. And for us, people living with HIV, it added an additional stress to our quality of life. Next slide. Okay, and part of what we're doing, I'm a volunteer. Actually, I preside the board of director of a small community-based organization called Ministerio Enjeguaser and Provistos that have been served this region for around 25 years, with the mission to provide and connect persons living with HIV and AIDS and populations at high risk for acquisition of HIV to support services to increase our quality of life. And we have one main project that is called Sigue Adelante, Move Forward, that we are emphasizing on empowerment and providing navigation, referral, and support services. And that was really greater in the hurricanes aftermath. Next slide. Okay, and within our ministry, 100% of our participants are under poverty levels, and that this was kind of evident after the hurricanes. And besides that, in the kind of a background, additional background of our population, of our participants, they already have basic needs that weren't well covered: food, utilities, transportation, adequate housing, and navigation services. And one of the things that within this region, especially the Arecibo municipality, suffered in the urban areas, suffered a large flooding in certain zones. The flooding got up to between 8 and 10 feet high. So many people had full loss of their houses, and that includes everything inside the houses. So the thing with the utilities and the communications weren't available for many months, although the mobile phone communication was really difficult to get. Even it recovered more quickly than the water and electricity, but still many people had difficulties in communicating with their family, with their relatives, with their clinics. And then added to that, in the hurricanes aftermath, the situation turned very bad. So we found very precarious conditions on housing, food, hygiene, transportation that were affected to our participants and to people living with HIV. And that was a situation that not only happened here in the Arecibo region, but also across the island. And people with HIV had especially the first month between September and October of 2017, have difficulties in getting access to their HIV services, to their healthcare services and providers, not only due to the communication, but also the roads were blocked with debris, and in certain areas it took a long time to recover, but still there were some great efforts that we'll be talking about. Next slide. Okay, what was the response? As I explained, the situation of our people has worsened, and our organization, with attending basic urgent needs to our participants. And the thing is that we gathered a group of volunteers, and that included our board of directors. Some of our participants became volunteers and helped us not only reaching out to other people, but we went to our communities and not only focus our assistance to the people living with HIV, but also to the families and the people in their community. So our reach in the aftermath was more than double of our expected target. So that was good because we found the need and we went out to the people. Even our office didn't have electric power or water, but we were able to manage with this team of great volunteers and reaching out to people. And we identify many needs beyond and the basic urgent needs and emergency needs that our participants had during that time. Next slide. During the first 2 weeks, our community outreacher were able, and our executive director, they were able to get out and they went to a local radio broadcasting station in San Juan that at that moment and for the first 2 to 3, I think almost to the first month in the aftermath was the only radio broadcast station that was on the air, and they kept uh, transmitting news and incidents and calling out to community leaders to get to them, and they were really open to the community. And then our community research and our executive director went there. They took a long trip from their home here in Arecibo to San Juan just to communicate, to inform, to try to get out to our participants that we were available, that we were making the connections and collaborations to receive help. And many other organizations did the same, and they called in for the participant to contact us for by any means they have on hand, either if they have some sort of communication available, they might try to call us, or if not, we were physically at the office, and they were able to get into to the office, and some of them did get to there. So our call to get in contact with the ministry brought good results. So at the same time, we contacted local and national organizations to provide emergency assistance, including the antiretrovirals for some of our people. And then one of the things that the ministry to resume our support services, we received a donation of a power generator to continue to resume our support services and continue providing services. We received many, and we are really thankful for all the support we received from different organizations. I know that NMAC was part of this effort through other organizations. We received support from AIDS United, I think from Broadway Cares, from a Healthcare Foundation, from many other organizations. We were thankful, and we received emergency supplies, we received food, and other things that our participants needed, but especially those who were in need of receiving antiretrovirals were able to receive direct donations from the United States, and from locally we were able to make arrangements to provide the medication to people who were really in the need of them. And we did, and we get to the places where they're staying, because not all people were staying at their homes because of the damage the homes suffered. But then we the assistance to where they were located. Next slide. In the next 4 months, from October to January of this year, we also received more donations of food and more emergency supplies. We made collaborations, and we were contacted through the local AARP office. For those of you that don't know, AARP is the American Association of Retired Persons. I'm a member of that group also. And to them, we made a collaboration, and we received, and through FEMA, we received a lot of emergency and primary care supplies, including hygiene products, some emergency products like this portable range and gases, and some blue tarps for some people, water containers, water bottles, and also we received assistance. We made a contact with the Red Cross to provide medical supplies, and also some private donors send collaborate with us, either with supplies or with cash donations, that we were able to use that to cover some more specific needs that were not covered by other donors. So we were able to make an ample outreach and cover the needs of many people. While that, during the Christmas time of last year, we were able to provide some kind of twist the church. We gathered some of our participants in a place, and the place where we did this kind of Christmas party, but was actually more to relieve them of the struggle they were facing after the hurricane. The place we did this event, the place didn't have water or electricity, but we were able to gather close to 50 people there and have some good time within the Christmas celebration. So that was another way we helped our participants, their relatives, their partners, their allies, and it was a kind of a nice thing that we did there. We coordinated our efforts, continued by coordinating emergency medical care. If the care was not available within the Arecibo region, we were able to provide transportation to either San Juan or other areas where the service were being provided. And we could provide that. We were able to provide that emergency medical care that our people needed. And we moved beyond our service area, beyond the Arecibo region, to provide assistance to other people, because in those contacts, in those collaborations, we were contacted by other organizations that wanted to make an impact beyond that. And you know that our region is mostly rural, so it was difficult to get there. But with these collaborations, we're able to reach out, and we reach out mainly to other adults or far beyond the services. I think we reach out to around 30 other municipalities in here in Puerto Rico, just to by accompanying these groups that were impacting through providing medical services or providing assistance into rebuild homes, and we did a great impact. And one of the things that we have, as I has mentioned before, was the full support of our board of directors. That was another great thing to have. Next slide. And in a continued response, we continue to enhance our collaborations with several community assistance networks that were formed just after the Hurricane Irma and Maria. And the thing is that these community assistance networks, they were, some of them, they have already structures set up there, but many of these networks, they were kind of networks, that informal networks that were created by the people within their communities, and with informal leaders that were there. They understand, they were seeing the needs of their community, and they organize people. So that was, and that's up to now, up to today. We continue to enhance that, to participate with these collaborations, because the people saw their needs and they were helping their neighbors or organize. So that was one of the good outcomes in the aftermath. The organization of informal community assistance networks, the empowerment and development of informal leaders within their community. When we call them, or when they call to us, they will reach out and they say, "Oh, yes, I can help, I can organize my community, just let me know, and we will help to get to the people that really needs the assistance." And one of the things that we did, we wanted these leaders not to come to us and say, "Well, I think my community need these supplies or this care." No, what we told them is, no, figure out, make kind of a census and for a survey around your community, explore your community needs, and come to us. Let us know what you need, and we'll, by any means possible, will make it possible to supply you and to supply your community with the needs. And that's really worked well, because instead of sending a bunch of supplies to the community, those leaders knew exactly what their community needs, and they reached out especially to those people that were bedridden, or that for any reason could move out to the places where the help was being distributed, and we were able to get to them. So that's another good outcome from all this process. And within this process, we have identified some changing needs. Many people still, they have a month, close to a month after the hurricane, they were able to access their HIV care, or they access their medications. But within this process, we have identified a lot of things. Although we have FEMA and the local government, they have set up some assistance programs still. Um, Sorry to mention that, but no, not all the not all of the outcomes from that programs were what people needed. And we have people who still need some home repairs. They want to keep living on their houses, on their homes, and we still have some people who need repairs. Many of our participants, many of our people living with HIV have worked. They lost their income. Many of them are, they work on their own, they are self-employed, and they couldn't make that, because not only because of the lack of power and water, of that they can access their supplies to produce whatever they were producing to generate income. Many of them lost their appliances, their furniture, lost all of their clothing. They were, the eyewear was also another petition. Even we have a petition of one of our participants requesting some kind of help, some kind of assistance to repair his car, because his car was affected by the storm, and he wanted to repair, because it's the mean, it was only his only mean of transportation, and to access his job, and to access his clinical services. So we receive those kind of requests also. So those are the changes needed, because in terms of health needs, we're pretty much covered. So there are more basic needs that add to the quality of life of our participants. Next slide. And as I mentioned, the impact of our outreach efforts in the aftermath of the hurricanes, and this is an ongoing process. We still identifying needs and figuring out how with different proposals that we have submitted and with different grants that we're receiving to cover the needs of our people. And then the impact is that these collaborations with organizations that their target is not usually persons living with HIV were great and were fantastic, because they were really heard us and were open to provide some assistance on that were really needed. And they were really open that we're focusing not only on people living with HIV with as our priority, but also we're trying to help other people, especially older adults living with HIV, and other persons that still are requesting our assistance to help them cover basic needs. As I mentioned before, we had a full support from our board of directors, me being the one of the chairs of the board. I continue to directly support and really actively involved in supporting the employees of the ministry and supporting the executive director in conducting not only our day-to-day work, but finding ways and reaching out to organizations and other people to provide help to our constituents. The other impact and the other good outcome is community empowerment. Actually, our communities are more empowered because, as the example I mentioned before, that Christmas party last year, even with all the difficulties we have, was a great moment during the year. We have continued to provide education, support groups, and other events that really have been a source of alleviating the burden that occurred during the hurricanes, and the burden some of our people are still facing. Community leadership development, that was another thing, and this is one of we are really proud on developing these informal leaders within our community, and they continue to provide leadership and support within their community. And the volunteer engagement is really great to get our participants not only receiving their healthcare services within our organization, but also making themselves available to support and to get out to the communities. And I think those are the things that are good within the impact we have in the aftermath. So not all the things were bad or worse. So we are getting a lot of good things on from organizing our communities in need, communities of people living with HIV that, besides dealing with their HIV status, that we deal with a lot of stigma and discrimination, and in this way, participating with us in all of these assistance efforts, they were able to be present, to be empowered, and to get something that they want to be. The sense of giving out to the communities is something that we were receiving on that, and we're grateful again to all of the organizations that help us, not only the organizations I already mentioned, but also There is a local advocacy organization called APIA. We've been in contact with them. We have helped people in San Juan and in other regions through APIA, but also they have helped us make contact with other organizations to provide more assistance, and we were grateful to that group. So it's really been uh, a fantastic effort, but we're really pleased that we were able to help our people and to provide them uh, something in return to increase their quality of life. And that's basically our presentation. And although things are coming up across the island, they are getting better, but still we have it's slow. The recovery has been slow. It will take many, many, many years to fully recover from the impact of the hurricanes. But one of the things that we have found is the resilience of our people, and they really have a lot to be thankful for, especially in this during this holidays period. Uh, we're really grateful of all the assistance we're receiving, with all the support we're receiving, and we hope to continue to receive this support and to provide support and assistance to to our people here on the island. And basically, Chip, back to you. Basically, that's our presentation. If there is uh, another questions or comments, we're available for that.
Hey, thank you, Angel. And Angel also let us know that he would be able to share his email address in case you had any further questions or any contact you wanted to have with him after the webinar. So now I'm going to go back real quickly, and so you can. Oops, sorry, that's not what I intended to do. Let's go back here. So again, if you would like to reach out to Angel, here's his email address, and he is happy to take your emails and answer your questions. Right now, we're going to throw it open for questions and answers. And while we're waiting for folks to ask questions, I'll throw one out, Angel. What would you say is currently the biggest challenge that people living with HIV are facing in Puerto Rico?
I think at this moment the big challenge is I mentioned this during my presentation. Some of them it's housing, to have their repairs to their homes, because many of them, especially in the rural areas, still are having issues with their homes. Even with all of this assistance, they haven't been able to repair their homes. Some of them were denied assistance from FEMA, and we're figuring out through other programs if they could receive assistance. But the response from the people in charge of those programs is really slow. So we're figuring out how we can move this more quickly so people can get at least at least the basic repairs for their houses, so they can live there or go back to their homes. And I think with the furniture and appliance also is a really huge need still, and assistance with utilities. But if they can't get their houses repaired to a reasonable condition, so we can help them in providing the appliances or the furniture they need, because if we do that, and there is some rains or some other major events that could happen, then they will suffer again damages to their house, and they will lose that. So I think that one of the urgent needs is to repair their homes. and some of them will need some transportation, and some of them want to go back to work. They'll need assistance on finding ways to or retrain them or finding or ways to get a new job. But especially the thing with the with housing, I think is the most urgent thing for people living with HIV, not only in our region but across the island.
Okay. Again, if you have any questions, please just enter them into the chat box, and we'll be happy to ask Angel. And I'll give this a few more minutes. See if you have any questions, just type them into the chat box. Angel, what's just while we're waiting to see if there are any more questions? What would you say is the best thing that those of us here on the mainland can do to sort of spur the recovery along?
The best thing from you is to contact directly community-based organizations, especially those community-based organizations located outside of the metropolitan areas, because those are the organizations that reach out to the rural communities and that knows the needs of people within the rural areas, and not not the needs of people living with HIV in the rural communities, because some of us could easily access the metropolitan area, could get access to San Juan, but many of our participants and many of the people that we serve who are people living with HIV, who are, as I mentioned during the presentation, who are under the poverty threshold. They are they are dealing with issues not only with these needs of housing, but also with their own physical health. Some of them are dealing with mental health issues. So one of the things is to contact these community-based organizations that serve the rural area and give them ask them about the specific, very specific needs, because at this time it's not about sending a whole bunch or whole packages of different supplies. I would suggest that you reach out to these organizations, if possible, visit them, make a kind of a survey of the needs of their participants, and focus on how you can help to cover those very specific needs. Now is the time to fulfill very specific needs of the people. If it is housing, if it is furniture or appliances, if it is some needs of transportation, some need of making uh, connecting them to other support services. I think at this moment, 15 months after the hurricanes, the moment to explore the specific needs of people living with HIV, and the best way to do that is reaching out to these community-based organizations that serve the rural areas, the rural communities.
All right, thank you, Angel. So we have no further questions. So I will wrap this up. Oh, I guess we do have a question. Sorry. So I have a question. Would you say we should send people to Puerto Rico to fulfill the needs of some of the communities, like a clinician, social worker, community organizer, et cetera, to help create programs in Puerto Rico? So should we send people to use their specific skills or training to help in the recovery?
I think that will add and that will really help us and try to identify through these community-based organizations if they have some large events during the year that we can combine, and instead of of getting another, for example, another bringing a group of people to here and trying to organize and coordinate another event. Figure out as these organizations, if they have some events already scheduled for the next year, and figure out if within the schedules of this group of providers or professionals, the dates that they have already set up for their events fit within their schedule, and then combine the events, and if they can be here, that will be great, because then that way we'll amplify our impact within the event. Most of the events are doing in the San Juan area, but I know some organizations, our organization is scheduling a community forum for March. So those are the events that we need to identify and try to combine this outreach, this assistance within those events or close to those events. That would be great to do. Yes, but that assistance will be welcome. Yeah, as I mentioned, it will not be the priority now, but it will be more than welcome.
All right, great. Thank you. And a great question there. Thank you so much for asking that. Seeing as we have oh, there's another one. So Jeremy, who's on the webinar set, was asked, if I sent you an email, would you be willing to provide some of the list of organizations we can reach out to? That way the conversation can be started now. I'm in Texas and I have no idea who to contact. So Jeremy, let me go back to Angel's email. So Angel, I'm sure you'd be fine with him reaching out to you for that sort of help.
Yes, and yes, you can reach me by my email, and if you have something specific in mind, you can, when you write to me, you can write about that. And oh yes, but I can provide a list of organizations that provide services to people living with HIV, who serve mostly the rural areas. But I will appreciate if when you write to me, just if you can mention specific ways that you think you can help, that will be better for us and for me to point you to specific organizations.
All right, thank you, Jeremy. And I think he's Angel, he said he's going to do that. So I'd say look for an email from him soon. Any additional questions from anyone? We still have a few minutes if you'd like to ask any more questions. If not, Angel, I want to thank you for being a part of this and thank everybody for attending today. This is our final Community Spotlight webinar. So I want to thank those of you who've been in our previous ones. Again, if you haven't seen any of the previous ones, they are available on our website, nmac.org/webinars. You'll find our webinar library from there with all of our webinars that we conducted this year. We don't have any more webinars currently concretely scheduled for next year, but there will be more coming. So keep an eye on our website, nmac.org/webinars, to see what will be coming in the new year. Again, thank you all for being here today, and we wish all of you a happy, healthy, and safe holiday season, and we will hopefully see you again in the new year. Thank you again, Angel, and thank you everyone for attending today.